When someone hears the words, "you have cancer," it can be one of the most frightening things. Fortunately, we live in an area where there is excellent care nearby. I'm with Dr. Charles Scarantino here at Johnston Health, the Clayton campus, and you're a radiation oncologist.
That's correct.
First of all, talk about what radiation oncology is as opposed to other sorts of cancer treatments.
Okay. Well, I'm glad to have the opportunity to go into that because I think there's a lot of misconceptions, unfortunately. But radiation is just another modality or way of treating cancer. It uses radiation, and I always tell my patients like taking an X-ray, only this is a very high energy X-ray because it is meant to kill cells. The important thing that people have to know or understand is that there is great advantages of getting radiation, and a lot of the times we use it in conjunction with chemotherapy. Now, there are times when we just use it alone. For example, early stage head and neck, we may just use radiation alone. Tonsil, tongue, vocal cord. In more advanced tumors of the head and neck, we'll use both, but in breast, we'll use it to treat patients who have had lumpectomy and then radiation. We know radiation should be given after lumpectomy because it reduces the chances of having tumor come back. In lung cancer, if it's not surgically operated, then we will use combination of radiation and chemotherapy. So radiation has many advantages. One of the most common cancers, skin cancer, we do very well with radiation. Oh. And people don't realize that.
I didn't realize that you do things on the outer layer.
Yes, it's a different type of radiation. It's electrons that don't penetrate very deeply. Oh. So if it's a basal cell, squamous cell, mainly. We don't do the melanomas unless they're really recurrent. It's usually resection when it's a melanoma. Okay. The other thing that we try to dispel when people come in is that you're not going to get sick all the time from radiation. It all depends on where in the body you're getting radiated. If it's the breast, the lung, generally there's no nausea, no vomiting, but depending on, but on the other hand, you may be able to radiate in the stomach and you're going to get some symptoms, or the gut, you're going to get some diarrhea. But generally, it's well tolerated, and with newer techniques, we're able to minimize the side effects from the radiation. So there's a lot of advantages, and there are important ways in which it can be done with chemotherapy.
Now, Dr. Scarantino, I think it's also important to point out that here at the Clayton campus, as well as in Smithfield with Johnston Health, you all have state-of-the-art technology at your fingertips.
That's correct. We can treat 97% of the patients that need to be treated here. There are some things we don't have, which we use the Rex Hospital or UNC, depending on the situation. But yes, we have everything here in Clayton and in Smithfield that most people will need.
To learn more about radiation oncology at Johnston Health, just go to the website at johnstonhealth.org.